On October 10, 2012, the Health Council of Canada welcomed over 375 delegates to its annual symposium, Advancing Integrated Healthcare in Canada, Practices that Work. Health Council of Canada Councillor Dr. Ingrid Sketris reflected on the events of the day. She began with highlights of plenary session speaker Dr. Dennis Codner.
He provided 10 main ingredients that accounted for overall impact, but noted it was unclear the degree to which each contributed and in which order these should be initiated. Among these were patient-centered focus, clear targeting of the population, active involvement of healthcare professionals, including family physicians, and innovative use of information tools. He noted that we had numerous obstacles, among them inertia, our acute care orientation, and turf issues. Next, Dr. Wright chaired a panel on solutions for achieving integrated care in Canada. Dr. Bailon commented on the fragmentation of the social and healthcare system and that there was too much focus on structure. What was needed were approaches that worked for the care team that was taking care of defined populations. Dr. Sawchuk was part of the Access Centre in Winnipeg, which seeks to bring about the integration of healthcare and social services, and discussed a virtual ward demonstration project. He commented on the need for collective action of the team. Ms. Park discussed the multiple roles of case managers and talked about a vision of bedside to boardroom. Ms. Sharkey called on us to engage more people in the conversation related to integrated care, especially amateurs. She discussed needing a social conversation and bringing in neighbors and communities. In our breakout sessions, we heard about the smart practices across Canadian provinces and territories. These were demonstrated in various patient populations: older adults, children, youth, cancer patients, and others. The presenters shared their experiences, their protocols and tools, and the commencement of evaluation approaches. We look forward to learning more about these projects as they transfer to other health regions, scale up, and become sustainable. We hope that you will contribute these to the Health Council of Canada's Innovation Portal, as well as contribute to international literature in this field, such as through the Journal of Integrated Care. We had a keynote address from Minister Horn from Alberta. He noted that the cost of care was one of the things that kept a minister awake at night, and just adding more money was not the answer. He discussed Alberta's primary care networks and challenged us to find approaches that would allow future generations to have better health care than us now. He talked about Canada as a land of pilot projects and the need to take evidence-informed practices and implement them system-wide. He talked about needing a movement to connect citizens with the health services they need. He discussed the government's role in leadership, workforce development, and policy direction, but discussed the need for a movement facilitated by both providers and users of the system. What about the future? We have been told that we need all hands on deck: politicians, policymakers, clinicians, evaluators, as well as patients, families, and communities. Ms. Sharkey suggested we need to be innovative in engaging stakeholders, including amateurs, and using novel techniques such as crowdsourcing. Dr. Codner challenged us to gather courage, as did the Lion and the Wizard of Oz. We need to organize, finance, deliver, and regulate care differently to support the needs of complex patients. He stressed the need to have an overarching vision, and that while we often discuss tools such as chronic disease management and case management, these are elements that contributed to integrated care. He also charged us to develop a common understanding of the concepts and terminology of integrated care so we can move together more readily. I will end with the need for evaluation. As Dr. Wright mentioned, when we started, if we had restricted the symposium to projects that were well evaluated, we would have had a very short symposium indeed. We did hear that teams are evaluating the patient experience, health outcomes, use of resources, costs of care, and other aspects. They are providing us with information about the enablers and barriers to their integrated projects and the lessons learned. Somehow, we need to develop an evaluation framework that can be adapted for use across regions and populations. In order to develop the capacity for such evaluation, I like Dr. Codner's suggestion to develop a global master's in integration of care. Perhaps universities in Canada will take up this challenge and develop or even lead such a program. As I could not touch on all aspects of the innovative practices and ideas, we encourage you to visit our Health Council portal and to get more information. As Murray said over lunch, he said, I wish I could split myself into 3 so I could go to all sessions, and that wasn't exactly possible, but you can see them on the website. In closing, I would like to thank the Health Council staff for all their work, the organizing committee, all speakers and participants. Thank you for your attention and a safe journey home.
Visit healthcouncilcanada.ca/symposium to watch more videos from the Health Council's National Symposium on Integrated Care.